You're now listening to the Adiel Gorel Show. Each episode, I'll bring you the latest news from my discussions with top health and wellness experts so that you can bring yourself into better health. Today, on the Adiel Gorel Show.
One of the biggest issues when it comes to diet that I see, even when people are following a plant-forward diet, is that they're not eating enough protein. Despite the keto craze and the high-protein diet craze, when I do a diet recall with patients and calculate how much protein they're eating, as I discuss in the diet chapter in my book, repeatedly I find they're not getting enough to maintain their bone health and their muscle strength. So 95% of fractures occur because somebody falls. So maintaining muscle strength and balance is really important.
That is fantastic. But before we go into that, and of course I want to talk about osteoporosis as well. Let's say that somebody decides to be really clean and healthy in their diet. They buy things from the local farm. They make them at home using the right. Everything is perfect. But that person would also be a social person. And friends would say, hey, let's go out for dinner. Let's go to celebrate your birthday. So dinner and lunch and even breakfast have become social pastimes that are the most common, almost. It's much more common you'll go to lunch with a friend or dinner with a group of friends than you'll even go to see a movie in a theater anymore. So, the minute you step into the restaurant, and I almost don't care which restaurant it is, it could be a 3 Michelin stars or it could be a hole in the wall, you are not in control of anything, of the fat that they use, of many of the ingredients that they use. Let's say there is meat involved or chicken. Where did it come from? Is it grass-fed, grass-finished? Likely not. How do we account for that part of our lives?
That's a great question. And what I really have talked to some patients where this has become an issue, where they start to actually feel anxious about going out to restaurants. And that's not good either. And the reason why is because the research is clear that social connection and social interactions are important for health. And not only that, being connected socially, doing things with friends, having that support reduces all-cause mortality. It reduces people's risk from dying from any cause, as I discuss in my most recent book. And so going out to breakfast or lunch or whatever it is can be an important social occasion that is very healthy. Once you're there, in terms of the food that you decide to eat, what I found, because I'm very picky with what I eat, there's always something there on the menu that will work. And I have no problem now, and I work with people and really help them understand that it's important to advocate for yourself, to ask for what you want and ask questions. Every time I've done that and asked, is it free range, for example? Do you have anything on your menu that's organic? Or I don't eat dairy, which I don't. I avoid dairy. Does this have dairy? Can I get it without the dairy? Instead of being cooked with butter, will you cook it with olive oil? Can I get sauteed vegetables instead of vegetables cooked in butter? These are the things that I do and my wife does, and it's every time we've done that, the waiter has been incredibly receptive. The chefs have been incredibly receptive because at the core, restaurants are service businesses. It's a service industry, and they want to make sure that their customers have what they need, and they don't want anybody to feel bad. They want people to feel good when they leave their restaurant. So part of it is just, I think, respecting what it is that you want. You want to be healthy. This is how you want to eat. And just asking if they can provide it. You can be polite about it. You can just frank. This is what I'd like. These are my restrictions. What can we do?
I have to smile even at your example of saying, can you replace butter? Because I already consider veggies cooked in butter a pretty good standard. In most cases, they would be cooked with some vegetable oils that you don't even want to know about. butter. Give me butter over that any day. You know what I mean? So there are
Yeah.
levels here. No, but that's a good point. I mean, I think that we all find our balance. So you talk about food as a chemical messenger. I like the analogy or the way of looking at it very much because it's basically, it's a conversation. Food comes into the system and it has a conversation with our body. That's a great
Mhm.
way to look at it. So, I mean, can you talk about this a little bit more? I really like this way of food actually is a messenger that comes into our body.
Yes, I love that concept. And when I talk about it, and when I've spoken about it before, I think people tend to understand the idea of food as messenger, of looking at the individual chemicals in there and how it interacts. And I can give you some more examples than I've already given, but it really starts before you even put food in your mouth. So the aroma of food will stimulate your nervous system to start secreting stomach acid, to start releasing stomach acid in anticipation that you're going to start eating. Acid is first your teeth of biting and starting to break apart and chew the food so you can get access to the nutrients. And then when you swallow, stomach acid starts to activate a whole cascade of events. It sterilizes the food. It continues to help break down the food so you can absorb the nutrients. It activates a molecule called intrinsic factor so you can absorb vitamin B12. There's just a whole, again, cascade of things that happen just with stomach acid. It activates some digestive enzymes as well. One big component, though, that I think people are missing is the fiber in foods, which is another reason why whole foods is so important. The fiber itself is a messenger. When you swallow that food, it's a whole plant food. It's a combination of soluble and insoluble fiber, and that feeds your gut microbiome. And and food that is deficient in healthy fiber will move the microbiome, that is the collection of organisms in our gut, in an unhealthy direction. Our microbiome, the bacteria that are there, are part of our immune system. They're part of our digestive system. And they help break down and digest food, but they also produce nutrients for us. They produce B vitamins like folic acid and other B vitamins. They produce serotonin, other chemicals. They help modulate inflammation. And those are things that our body can use. So giving those what's called a prebiotic, the fiber in food is an important messenger to your gut microbiome to act in a way that is healthy for your body. Then once you absorb those nutrients, you get into a whole other cascade of effects that they can have. And I'll just give you a couple of examples. Turmeric, the spice turmeric. The spice turmeric, which is in curry, and people can purchase as a dietary supplement, has important effects within our cells. One of the things it does within our cells is it increases what's called NF-kappa B, which is a molecule within the nucleus, nuclear signaling molecule that modulates inflammation. And so it can downregulate and decrease and help rebalance inflammation. MK4, a specific form of vitamin K2 that I talk about in my book when it comes to bone health, has been shown to activate NF-kappa B as well, but also genes to produce bone collagen for bone health, and genes that upregulate what are called osteoblasts, which are one of the two main cells in bones and what are responsible for building new, healthy, strong bones. So the example with MK4 shows that even with one nutrient, you can get multiple genes activated because the body does many things with one nutrient.
So you already mentioned and you delved into the field that I want to talk about now. Obviously, there is a book right behind you that you wrote, and I see the big word bones. So I'd like to talk to you about osteoporosis. Our viewers are male, female, in various stages of life. What can you distill for us from that framework?
Osteoporosis is a deadly condition and disease that many people don't even think about until they're diagnosed with it. And that's unfortunate because if you have osteoporosis and you break a hip, there's up to a 36% chance that you're going to be dead within a year. And if you're a woman over 45, your risk of an osteoporosis fracture is greater than your combined risk for uterine, breast, and ovarian cancer. Osteoporosis fractures, in fact, are responsible for more days in the hospital than other diseases like heart attacks and breast cancer. So it is a serious condition that should be on people's radar. Currently, there are over 53 million people in the U.S. alone with osteoporosis or at risk. But as the population is aging, that number is rapidly increasing. It is second globally as a health issue only to cardiovascular disease. So I hope that my book and my work raise awareness to this condition and what people can do about it.
So you did mention women. Is that, I think I know just from life experience that it seems to affect women more than men. But can you talk in general about why and also the percentages? Just
Yes,
roughly.
absolutely. 80% of osteoporosis occurs in women, 20% in men. The reason why it occurs in women, and primarily women as they get older, is because once women go through menopause and estrogen declines, that's when you get the fastest rate of bone loss. During menopause and for the 10 years after is when women lose bone the fastest, because estrogen helps to build bone and maintain bones and strong bones, but it also is anti-inflammatory. And so both of those things, once estrogen starts declining and the risk of chronic inflammation goes up, chronic inflammation destroys bone and is a risk for osteoporosis and fractures, but also you lose the bone building effects of estrogen. So both of those things combined increase women's risks that men don't have.
But men must have a corollary pathway that builds bone. And what is responsible for that in men, and how does that decline with age, if it does?
So what happens is testosterone, which women have as well, but men have more testosterone than women. Men also have estrogen. We have less than women, but we do produce estrogen. That if men's hormones decline, and we see this in certain diseases, like if a man is on a drug that blocks testosterone production, leuprolide is a medication that does that, they are at increased risk for osteoporosis and fractures. What happens though, even though there are fewer cases of osteoporosis in men, if a man with osteoporosis breaks a bone, their risk of dying is almost twice what the risk is for a woman.
Why would that be?
That's a great question, and it's been speculated in the research why. And the current thinking is that it's probably due to, as men get older, the other diseases that they have tend to be more severe than women. And so they're at risk from the complications from the fracture. Now, if you get a fracture and you die, it's not like a car accident where it happens right away. This is something that typically happens over months. It starts this downward progressive deterioration that ends in death. And so for men whose comorbidities, like high blood pressure, cardiovascular disease, tends to be more severe than women, they're then at higher risk for dying from a fracture than a woman is, even though their risk of osteoporosis is less.
Okay, so I think we talked enough about men in this context because women really should be the focus, at 80%. Is there a difference in the risk of for getting osteoporosis if a woman gave birth or not?
That's a great question. So I don't know the answer to that specific one because it's not showing up in the research of the major risk factors for osteoporosis. Nutritional deficiencies definitely is a risk factor for osteoporosis. Getting your period early is a risk factor for osteoporosis. Having multiple babies is a risk factor for osteoporosis. Not necessarily just having one baby, but having multiple babies is a risk factor for osteoporosis. Bigger and I think more important than all of that, however, is medications right now. What we're seeing right now is an epidemic of osteoporosis caused by medication that's going under-recognized because the conventional doctors don't know that they're actually creating osteoporosis and fractures. And some of the biggest culprits are antidepressants and acid blocking medications. And you've got tens of millions of people, primarily women, on antidepressant medications. And we know now that if a woman is on an antidepressant medication, an SSRI, like Prozac, for example, or an SNRI, anything that artificially increases serotonin, there's a risk of, for every 19 to 49 people taking that medication, one of them we will expect will break a bone. Similarly, with acid blocking medications, after 4 years of taking an acid blocker, there's an increase in 60% risk of getting a hip fracture.
So if we go back to something you said before about the lack of magnesium for some people and that being part of creating, the serotonin pathway, maybe we can connect these two dots and have people eat better, they get more magnesium and some other minerals and vitamins they need. Maybe they will not resort to the antidepressants. I mean, this is kind of a roundabout connection. This is very worrisome. What can a woman do? I mean, there's a lot of talk about bioidentical hormone replacement, and we're not going to get into the pros and cons here because this is not the scope of this talk. But I mean, if somebody is getting bioidentical replacements, will that mitigate the risk, of osteoporosis?
Yes. Yes, it will.
Okay. Well, I mean, that's, and plus, okay, if we talk about the people who are at risk, mostly women, based on what you said, you could be eating well, you could be supplementing well. Nevertheless, what other things can a person, women and men, do to keep their bones in the best shape that they can?
That's a great question. So there are a couple ways that I think of this, and that is, what can we do to promote healthy bone physiology and maintain strong bones and healthy bone density? One of the biggest issues when it comes to diet that I see, even when people are following a plant-forward diet, is that they're not eating enough protein. Despite the keto craze and the high protein diet craze, when I do a diet recall with patients and calculate how much protein they're eating, as I discuss in the diet chapter in my book, repeatedly I find they're not getting enough to maintain their bone health and their muscle strength. So 95% of fractures occur because somebody falls. So maintaining muscle strength and balance is really important. But there are over 200 proteins in bone. And so making sure you're getting enough protein is, as well as other nutrients, is really, really important. There are supplements that have shown to be helpful, which is why in 2006, working with my patients, I couldn't find what I needed in the dose or combination of nutrients to help them for their bone health that was shown not only to support healthy bone density, but to maintain strong bones, as indicated by reducing fractures in clinical trials. I created the products OsteoK and OsteoK Minis that have the 45 milligrams of MK4, the nutrient I mentioned, plus calcium and vitamin D that have been shown to maintain strong bones, as indicated by more than 70% fewer fractures, which is incredible. And in terms of other nutrients, supplementing with collagen has been shown to slow down the breakdown of bone collagen. And it's not just the bone minerals that are important. A bone mineral density test only looks at the mineral content of bone. And a bone density test only predicts 44% of women with osteoporosis who will break a bone, and only 21% of men. And that's because there's another component, major component of bone, besides the minerals, that is actually more important for bone strength, and that's the collagen, the connective tissue in bone. And that's what gives bone its flexibility, its ability to withstand the force of a fall and deform a little bit and not be brittle and not break. So collagen, osteo-K, diet, exercise, and other things that I discuss in my book all are very important for supporting bone health, supporting bone strength, and maintaining strong bones.
Does exerting pressure on the bones strengthen them, like lifting weights?
So lifting weights will strengthen the muscles and improve balance. Exercise like that also can stimulate bone production. And there have been studies showing an increase in bone density with those types of exercise. Vibration will even do that too. Using vibrational plates can do that as well.
What about rebounders?
Yes. I don't know any clinical trials on that, but if nothing else, it improves balance, and anything that can improve balance will reduce the risk of falls and fall-related injuries. That includes fractures.
Well, let's just get, I would like to read your book. Can you mention the full name of the book?
Yes, the book is called Fracture Proof Your Bones.
Fracture Proof Your Bones by Dr. John Neustadt. And you have some other books on Amazon, so we can look for them. There must be a website where we can get some of your good information. Where would we go?
It's all available at nbihealth.com, nbihealth.com. Lots of blogs, free resources on there, downloads, things people can take to their doctors to talk to them about. It's a great resource, as well as the supplements, and the book is there as well.
So that's N as in Nancy, B as in Bob, I, health.com. nbihealth.com. John, I want to thank you so much. I know you're a busy guy, for taking the time to be here with us. We hope to see you again in the future. I want to thank you again. Thanks a lot for being here today.
Thank you.
Stay tuned for part 2 of this interview. Thank you for joining us today. I know you love what's coming next in part 2. Be sure to click the subscribe button for more videos.